I'm Miracle Adesina. I'm the country coordinator of Nigeria for Slum and Riot Initiative. Slum and Riot Initiative is a youth-led, research-intensive, non-profit organization in Nigeria that is focused on providing access to healthcare, especially mental health for young people and historically marginalized communities. It's a pleasure to be here to talk about the mapping of the mental health care facilities in Nigeria using the Geographic Information System. This connects to the keynote session yesterday by Jonathan Bonds on mapping mental health, and this is a brief outline. I'm confident we're all aware that Nigeria is the most populous nation in Africa, the giant of Africa, with over 200 million people. And despite the increasing awareness of mental health issues globally, Nigeria's mental health system remains largely underdeveloped. And according to the World Health Organization estimates, about 20% of Nigerians, about 40 million people, suffer from one mental illness or the other, although recent estimates put it as about 30%, that's 60 million Nigerians suffer from one mental health disorder or the other. With this large population or this large burden, there's a very important need to map or to know where the existing mental health facilities are. This study comes from I have a personal reason for conducting this study with my team. About a year or two ago, my younger brother had some early psychosis symptom. I needed to be treated in a mental health facility. Although I'm a mental health professional, I did not know the closest mental health facility where he could be taken. So I had to call around, and it took a lot of time for him to get the help that he needed. So it motivated me to conduct the mapping of the mental health facilities in Nigeria. So a lot of organizations, non-profit organizations, researchers, psychiatrists doing sensitization and advocacy about mental health, trying to destigmatize different things regarding mental illness in Nigeria. But a lot of people that need help don't know where they can go and seek help. It's surprising that sometimes like a mental health facility can be in your environment and you don't know such facilities are present. So this study is quite essential in trying to understand the distribution of the different types of mental health facilities in Nigeria, with over 200 million people and 60 million people that need mental health care. So to conduct these studies, and my team did a comprehensive search for mental health facilities in Nigeria via Google search, also searching through Google Maps, social media, Ministry of Health websites, and other platforms, where we collated a comprehensive list of all the mental health facilities that we could get from all those platforms in Nigeria. Then after we compiled the list of the facilities, the next step was verification of the facilities functionality. For facilities that had phone numbers attached to them, we called out the facilities to verify if they were still functional. Then aside from that, we also sent emails to facilities where the phone numbers were mentioned or highlighted. Aside from that, we also checked for social media reviews, reviews on Google Maps and all those different platforms to verify functionality of these mental health facilities. Then we got the geographic coordinates using Google Earth. The data was digitized and presented using the ArcGIS software. So from our research, we're able to identify 103 mental health facilities in Nigeria, and they cut across these different categories. The federal neuropsychiatric hospitals are specialized mental health facilities that is coordinated by the federal government of Nigeria, that is focused purely on mental health care. Aside from that, we're able to identify general hospitals. These were secondary healthcare facilities that had mental health clinics as part of the clinics, but not specialized for mental health care. Then Armed Forces Mental Health Clinic, PTSD, for example, is common among the armed forces. So we identified one Armed Forces Mental Health Clinics to serve this. Then non-governmental organizations with clinics to provide mental health care. Religious institutions also had their clinics. Then private sectors had clinics too. Then we also found university teaching hospitals with active mental health department. Going to the Federal Neuropsychiatric Center, we had almost equal distribution across the different geopolitical zones in Nigeria. Nigeria has about 6 geopolitical zones, but there was no Federal Neuropsychiatric Center in the north-central parts of the country. So no specialized mental health facility to serve the population for that region. Then, aside from the Federal Neuropsychiatric Center, we were able to identify 12 general hospitals that had mental health clinics. But looking at the distribution of most of these facilities was in the southern region of the country. We have like 4 in the southwest, 2 in the southeast, 3 in the northwest, 6 in the northeast, 5 in the north central, and 5 in the south. This map is trying to show the different states where these facilities are. Then, aside from this, we found 11 university teaching hospitals that had active mental health departments. Also, the distribution was more in the southern region than in the northern region. Notably, there was none in the northeast. There were just 2 in the north central and 2 in the northwest. The private sector had the largest contribution when it comes to mental health facilities in Nigeria, with about 63 mental health facilities run by the private sector, but the prominence was majorly in the southern region. Like, we had about 69 facilities alone in the southwest region, with the predominant ones in states like Lagos State. Then we had about 15 in the north central, 3 in the south, and the other parts of the country. To wrap up this short study, we have seen the distribution of the different mental health facilities in Nigeria. One limitation of this study, one thing I might think we were not able to explore, was trying to look at correlate the presence of these mental health facilities with the distribution of the different mental illness in the different geopolitical zones of Nigeria, but there was no existing data. But I believe that this study is a right step for trying to bridge this gap in access to mental health infrastructure in Nigeria. And I also believe that this would also help people that need access to mental health care to be able to identify the facilities that are closest to them to seek help. Thank you for listening.